Hello and welcome to the 2019-2020 Employee Benefits webinar for San Rafael Healthcare. Over the next 15 or 20 minutes, we're going to be going through medical, dental, vision, and supplemental plans offered through Colonial. Before we do, we want to remind everybody of when folks are eligible and that you need one of these IRS-approved reasons to change what you choose in the middle of the year. In general, what you pick sticks for 1 year unless you have one of these qualifying life events. We're going to be signing up again through Employee Navigator. This is an online enrollment system. San Rafael Healthcare has our own website to be able to log on, whether it's on a computer or sitting on your couch with your cell phone. This website will take you through, and it'll be kind of like an Amazon buying experience where you add what you want and there's a tally that will come up on the right-hand side to show you exactly what's going to be coming out of your paycheck for anything that you choose. We'll spend the most amount of our time on the medical aspect of the employee benefit offering. And that's because we did have a change this year. We are with United Healthcare now, and that's because we want to make sure that we maintain as consistent of pricing as possible. So for most people that are on the plan now, the pricing only changed a couple of dollars a month. So not a huge price change. We did not get an offer that we felt like was acceptable from the previous insurance carrier, so that required us moving. We have two different plans. One plan is a less expensive option. One is a little more expensive option. The less expensive option has no out-of-network benefits. And so that means these schedule of benefits are available for any hospital or provider that is in network with United Healthcare. They are the largest insurance company in the country. We have not had a problem with their network before, but it does mean that if you choose to go out of network, then there is no benefit on this base plan. Now, that doesn't apply in an emergency situation. If you are in an ambulance, God forbid, and you go to an emergency room and that is an out-of-network provider, that's required by state law to be covered as in network. So what you'll see here are some preventative services. When it says 0%, that's a good number. That's the number that you want. That's the amount that you pay. Now, we'll show you a more detailed view of preventative services in just a second. If you're on this base plan, you're either paying $30 or $60 to go to a primary care specialist. But I do want to highlight the fact that in-network office visits, primary care is $0 for members less than 19. If you go to what's called a premium designated specialist within United Healthcare. So you'll be able to go on the app and look up different providers. If that provider is designated as a specialist, then it's $0 for you for anybody under 19. We really like that feature about United Healthcare. So it could only get better from here. Ready Clinic or a Minute Clinic, those are your urgent type care clinics, $30. Virtual visits is $0. That's 24/7, 365 access to a doctor over the phone. Really great feature. We've got some additional information in there in the guide in a couple of slides. The deductible on this plan is $3,000. Co-insurance means the split between you and the insurance company after you pay the deductible, up to a $6,000 annual out-of-pocket max. That applies January to December. Here's another example of an urgent care versus, I think I called these an urgent care. That's more of a Ready Clinic or a Minute Clinic. Emergency room, you'll pay $250 to walk in the door, but if they do some testing or diagnostics on you, then that would go towards your deductible. After you meet your deductible, you're paying 20% of the bills that come in, up to an annual $6,000 out-of-pocket maximum. These prescription copays also track towards this number. So think of this out-of-pocket max as worst case scenario. All of these copays track towards that number. Any of these copays track towards that number. And the deductible is also included in this number. So you've got three different tiers of copays, again, that all track towards this out-of-pocket maximum. Now that's the least expensive plan. That's the base plan. The buy-up option is a full network, in and out of network benefits. We only show the in-network benefits here. You are entitled to receive a full schedule of benefits, so just let us know if you'd like to see the out-of-network benefits as well, because we'll have all that information ready and available for you. Office visits are a little cheaper on this buy-up plan. Ready Clinic price of admission is a little cheaper. The deductible is lower, and the out-of-pocket maximum is lower. The RX copays are the exact same. It's really just a function of these copays being lower up here and the deductible being lower, and the fact that you've got out-of-network benefits that apply January to December, and those are stated there on the bottom of page 4. Here are the price tags that are coming out of your paycheck. So depending on which tier of coverage you're enrolled in, it changed a little bit. Healthcare usually goes up between 6 and 10% every single year. We, again, did not get an offer that we considered to be acceptable for our employees, and so we had to move insurance carriers. We try and minimize that as much as we can because we know that it creates some complications, but felt like this was a good move because we kept pricing as stable as we possibly could. A couple more rules of the road, where to go, when. These are your Ready clinics. We mentioned those. Urgent care. Freestanding ER is popping up all over the place. Only go there if it's life or limb threatening. That's an ER outside of an emergency room, and they're going to bill you like an ER as well. These are some slides on preventative care. You'll have access to a printed version or an online version of this, so I won't go over this for sake of time, but just know that if you go into a preventative care visit that's covered at 100%, meaning it's free to you, but you ask a doctor to check out a mole on your back, the doctor does that. That is considered diagnostic, as an example, not as preventative. So also helpful information to know about what is not included in preventative care. I love these next couple of slides. GoodRx is awesome. It's a great way to see if you can get a better deal on prescription drugs than you'd be able to get through your insurance program. They've got an app, they've got online. I was just on there yesterday looking at pricing of drugs to see if I could get a better deal on my own insurance plan. MyUHC.com, good source to go online, research in-network hospitals, providers. They've got a great app that you can download. You can track where you are on your deductible. Virtual visits, I mentioned a little bit earlier. This is $0 to you. We really like that feature. 24/7, 365. These are the reasons why you would call them. Just as a personal note, I did this the first time sitting in the middle of a coffee shop, and I saw the doctor, got my prescription inside of 19 minutes. Second time I did it, my third kiddo had pink eye. We knew exactly what it was because her brother had pink eye, and we just needed to get some amoxicillin. Really easy way, took care of that in about 20 minutes. Dental we've offered in the past. We're continuing to offer it, but it's with a new carrier. So United Healthcare is going to be the insurance carrier for medical, dental, and vision. The plan is the same as it was in the past. The deductible is low, $50 per individual. And think about this $1,000 annual max like $1,000 a year that United Healthcare is going to throw at your mouth. So here's the way that that works. Let's say you go in for a preventative service. It's 0% deductible waive. That's a freebie to you. So that's your cleanings, your routine exams, x-rays, sealants, things like that. But let's say they find a cavity that would be considered a basic service. Let's say the cost of that cavity is $200. Here's how it works. $200 minus $50 deductible, you have a $150 bill. You're paying 20% of that $150 bill, or $30. The insurance company is paying 80% of that $150 bill, or $130. That $130 reduces that $1,000 on an annual basis. That's how that works. Depending on if it's basic or major, you have either a higher or a lower split, which is coinsurance, between you and the insurance company. The rates are here, didn't change a whole lot from last year, so we like that feature. We're also offering a new vision plan this year. Here's how this works. Lenses, you've got a $25 copay, okay? I do want you to know that if you're like me and your vision is as bad as mine, that you will likely have an additional expense above the copay. I've got to shrink my lenses down just to fit on my face. So if you've got really good vision, you might be able to get out just for a copay. If you've got really bad vision and you want to shrink them down, then you're probably not getting out for a copay. But UHC will spot you $150 for frames or $150 for lenses. What this mumbo jumbo right here means, this once every, it means this. You can't get glasses and contacts paid for by the insurance company at the same time. You pick one, self-pay for another. Rates are right down here, pretty easy price tags to absorb. And now the rest of the information in this guide, except for the ending pages, are a variety of what we call voluntary supplemental benefit plans. So as you'll notice, there are gaps in a medical policy, or when an accident happens, you'll have to meet your deductible. Or God forbid, if you get cancer, you'll have to meet your deductible first. And so supplemental benefit plans send cash money to you instead of to doctors or hospitals. So if you are, God forbid, disabled, if you get in an accident, if you go into a hospital, if you get cancer, variety of critical illnesses, or you just want more life insurance, then you would purchase that through Colonial. There's a woman named Kelly who is the Colonial rep, and there's a lot of information in here. It's broken out by age and dollar amount, depending on what the line of coverage is. So if you wanted to know whether or not you wanted to buy disability, you would pick how much the amount would be depending on your age, and then the fallout pricing would be here. But honestly, the best way is just call one of the representatives in the back of the book and say, I'm interested in fill in the blank. Can you help me figure out what the right product might be for me? Because there's a lot of information and your eyes can go crossways on trying to evaluate it. So call an expert. So there's disability insurance, a couple different types. Accident insurance, that's where if you get in an accident, even if it's a sprained ankle, car accident, jumping on the trampoline, kids get in an accident. I had a woman in our office actually have her son was a wrestler and kept getting his arm yanked out of socket. She used her accident plan a lot that year. So a variety of things that it covers. It depends on severity of injury. Again, here I recommend you talking to an expert to right size what the benefit could be to you. Cancer insurance is broken out by type and diagnosis. There are a couple of different types of cancer insurance. One pays a little more, one pays a little less. Hospital confinement means if you go into a hospital, you get a certain amount of money per day depending on how long you're in the hospital. Specified critical illness, those are heart attack, stroke, end-stage renal. So if you have a family history of things like this, this may be a policy worth investigating to see how it would pay out on your behalf. The Employee Assistance Program is paid for by your employer. It's free to you, confidential. It's a great referral source for anything marriage, family, or financial related. One of the best ways that I like this is they can help you get on an online will prep service up and going for you. So see some value there. Here's some more information about how the Employee Assistance Program works, called Care24. Is in this guide. The rest of the information is great late night reading material and required notices, except for the last page, Q&A. Enrollments, when they are made effective, what forms must be completed. Employee Navigator is the online system. Here's when it'll open and close. Here's again the link for Employee Navigator. Depending on if you're a new user or not, some information about our contact information. Jamie is a great point of contact. She is the San Rafael dedicated point of contact within our company. We're Catto&Catto. We're insurance brokers, so we help find, price, and explain insurance programs to employers and employees. And Colonial, Kelly is there. So if you have questions about the information on the last 10 to 15 pages that is about Colonial, then please contact Kelly. Just in case you're interested and want more insurance knowledge, here's a glossary of terms And with that, we'll let you get back.